My name is Brenda, and I am the Content and Curriculum Manager for Kaplan Nursing. Today, we are going to review a dynamic test item writing option called the matrix grid. During this video, we will look at examples and discuss the matrix grid format that includes two types of items, multiple choice and multiple response. This question type allows the student to select one or more answers from each row or column. This format is an important type of question because it allows the student to be tested over several segments of the client's situation or scenario. At the conclusion of the video, I will provide you with some item writing tips as you prepare to write your own case studies and matrix grid questions. In all NGN question types, the student will see a display of tabs which contains information from which the student will make decisions and choose options. This is an example of a client's medical record with 4 tabs consisting of the health history and nurse's notes, the client's vitals and lab results. During the exam, students can easily toggle back and forth between the tabs. For demonstration purposes of the medical record, this slide displays an example of a mock nurse's note. On this slide, you are viewing a 2-column matrix multiple choice option. On this question type, the student will read the assessment finding and based on the information provided throughout the case study, determine if the education the nurse provided to the client has improved their understanding of the home maintenance topics or if they need further teaching. Again, each row must have a chosen selection in order to progress to the next question type. Here we created a 3-column matrix multiple choice item. In this example, as the case study progresses, the student will be asked to identify if the assessment findings have improved, there have been no change, or if the client's condition has declined. Again, the 3-column matrix multiple choice option, the student will choose one option per row. I wanted to include some additional examples of heading choices. You can become very creative with both the 2-column or 3-column matrix multiple choice grid. In the top example, you could develop a question around nursing interventions and ask the student if the intervention is indicated or not indicated. In the lower example, you could develop a question around the nursing assessment findings and ask the student to determine if the finding was expected or unexpected. The second type of matrix grid item type is the multiple response grid, where the student addresses more than one aspect of a client's situation. There can be between 2 and 9 columns and 4 to 7 rows. The matrix multiple response question type allows each column in the table to be an independent answer. The student will answer at least one option in the row, but all column options in that row could be correct, similar to a select all that apply. In this example, the student will choose which disease process is consistent based on the findings provided in the first column. As the student determines their choices, they will conclude which disease process the client is experiencing. Here are some additional heading choices for the matrix grid multiple response item type. In the top example, you could provide the student with a list of client needs or care interventions and ask the student to determine who could perform those care items. The second example lists the client's medical condition. The student can be asked to anticipate which diagnostic test or test would be ordered by the provider to evaluate the condition further. This graph provides you with a quick reference crosswalk of how the matrix grid question type can be used to assess the 6 cognitive skills in your case study. You will notice the matrix grid multiple choice can be utilized when writing questions for analyzing cues, generating solutions, taking actions, or evaluating outcomes. The matrix grid multiple response NGN question type can be developed to test the student in all 6 cognitive skill areas. Let's take a few minutes to review some item writing tips. The objective of case studies is to evaluate how well students can apply content to a specific clinical situation. The objective can focus on a skill, task, or concept the student has learned. When developing a clinical problem, you can use a variety of sources to help create your case study. Drawing from personal clinical experience, utilizing case studies from your student assignments or lectures can be useful. For students who are just beginning their program, write questions that will focus on the fundamentals of nursing practice. And as the student advances through the curriculum, questions will need to evolve as they prepare to practice in the clinical setting as a novice nurse. Thank you for taking the time to review this video. We hope these examples and tips will be helpful.